we'll get started shortly. Thank you so much.
World, and with overcrowding in hospitals, it's calling on neighbouring countries.
Good evening, everyone. Thank you for joining us for our third Environmental Justice Rulemaking Stakeholder meeting. For those of you I haven't had the pleasure of meeting before, I am Olivia Glenn, the Deputy Commissioner for Environmental Justice and Equity at the New Jersey Department of Environmental Protection. Today's presentation is building on a platform of the passage of the Environmental Justice Law on September 18, 2020, the first such environmental justice law in the country. This law does not go into effect until we adopt rules, and today's discussion is a continuation of the process that gets us to rule completion. If you missed our opening meeting in October and either of our previous two stakeholder sessions, You can find recordings and presentations on our Office of Environmental Justice website at nj.gov/DEP/EJ. Can you go to the next slide, please? In the same spirit that you can find former recordings and presentations on our Office of Environmental Justice website, please note that to continue that effort, we are also recording tonight's meeting. If your screen looks like mine, you'll see a bar going across the top saying that the recording has started. So this meeting is officially being recorded, and please note that by participating in tonight's discussion, by listening in, as well as if you share any written or verbal comments, you are consenting to those things being available for the public to see and to hear. So as we continue on, here are just some rules for engagement that we'd like everyone to consider. First is if you can remain on mute unless you are speaking. I'm opening the program today, and shortly our Chief Advisor for Regulatory Affairs, Sean Moriarty, will give a presentation. But please know that intermittently you are able to raise your hand and we'll call your name. And at that time, you can take your microphone off of mute and you can ask any question that you may have. But really, to ensure the integrity of tonight's recording, it's really important that you keep your phone muted. Second, when you are ready to speak, we have a raise hand function. So in the banner across the top, you'll see a smiling emoji with a hand raised like this. And if you click on that emoji, within that menu, you'll see a menu come down and you'll see one of the things has a hand like this. If you click on that, that actually raises your hand and we will call your name in the order that we receive it. We're going to ask that everyone treats everyone else with respect and that you limit your comment or question to the topic that's being discussed this evening. Please do note that we want to limit discussion comments or questions to 2 minutes, and I will physically raise my hand just like this to let you know that you've approached 90 seconds and you may complete your thought. And again, I just want to underscore that tonight's meeting is being recorded and will be posted on the DEP website after this session concludes. Next slide, please. So on the agenda for tonight's meeting, you can see that we are going to do an introduction and rules of engagement, which we just discussed, to talk about definitions relative to the impact of pollution on overburdened communities, to talk about our process for evaluating potential stressors. And we have been participating in some pretty robust deliberations internally. We've gotten some feedback from some of New Jersey's foremost environmental experts, environmental justice experts specifically. And they also brought to us some of the nation's foremost environmental justice professionals. So we've already been doing a series of deliberation, and we look forward to the feedback that we'll get from attendees tonight. In addition, we're going to have discussion of environmental stressors and conditions that may cause public health impacts. And finally, even at the end, we're going to set aside some more time for questions and answers. So just something to consider as you're going through hearing the presentation tonight is to see if you think there are any stressors we should add, if you think there are any we should take away, and if there's something that you feel like is so integral to this work, you want to make sure that we keep it in. Those are just some of the things you can consider giving us as feedback this evening. And just in advance, I want you to know what our next step is going to be because we want to continue to engage in these ongoing dialogues. We will have a future stakeholder meeting on April 8th, and the topic for that meeting is going to be compelling public need and renewal conditions, with a morning session for business and industry and an evening session for environmental justice and environmental and community organizations. So we look forward to engaging with you in that future meeting. And for the sake of tonight, I am delighted to pass you over to my esteemed colleague, Sean Moriarty, our Chief Advisor for Regulatory Affairs.
Thank you, Deputy Commissioner Glenn. And good evening, everyone. And thank you for joining us for round 3 of our stakeholder engagement process. As Olivia has already mentioned, the topic of today's discussion is environmental and public health stressors. Specifically, we're going to be soliciting your feedback on how best to define and quantify the environmental and public health stressors that we're required to analyze under the environmental justice law. As with each of our discussions, the bill will serve as our guidepost and the pillar upon which we build today's discussion. The bill defines environmental and public health stressors together, but I like to break it down into its component parts. First, environmental stressors, and those are defined as defined as sources of environmental pollution and include the enumerated examples you see on the screen. Those are concentrated areas of air pollution, mobile sources of air pollution, contaminated sites, transfer stations and other solid waste facilities, recycling facilities, scrap yards, and point sources of water pollution, including but not limited to water pollution from facilities, direct discharges, or combined sewer overflows. On to public health stressors. Those are defined as conditions that may cause potential public health impacts, including but not limited to the enumerated examples in the bill again: asthma, cancer, elevated blood lead levels, cardiovascular disease, and developmental problems for individuals in those overburdened communities. Of note here, and as we've discussed previously, is the term may cause, which allows the department to consider present conditions that may influence these public health stressors. As we move forward, that may result in some overlap in the data we use to better define both of these stressors. For example, mobile sources might overlap with sources of air pollution, both of which are relevant as conditions that may cause potential health impacts, such as asthma. You might also note that that there is some obvious overlap between these environmental stressors, particularly the listing environmental stressors and the facilities that are subject to the environmental justice law. We take that as recognition by the legislature that these pollution generating facilities are, when concentrated or in abundance in our overburdened communities, are in and of themselves stressors. As we have in the past, we're going to attempt to walk through this systematically. We'll take you through potential data sources to define each of those stressors that are categorized in the bill. Before we do that, and to try to provide a little bit of context for people to understand the process of how the rules might treat these stressors, we're going to talk a little bit about how that might work. So again, we would look to the law to guide us. The law requires permit applicants to prepare an environmental justice impact statement that assesses the environmental and public health stressors associated with the proposed or expanded facility, or in the case of renewals, existing major source of air pollution, as well as the existing stressors already borne by the overburdened community. Next slide. The law then requires DEP to consider the new or expanded facility stressors together with the existing stressors affecting the overburdened community as part of its permit review. So that makes identifying the stressors a key part of the assessment of whether a permitted activity and its impact on the overburdened community. So one thing to note here, and we'll talk a little bit about this in more detail as we move forward to stakeholdering, but there are likely to be a couple of steps in our review process. One, where a facility would assess essentially kind of the status of a specific block group and whether it is overburdened or not. That would be likely a longer list of stressors that is more robust, that takes into account a lot of the things that we'll talk about today, from facilities present to mobile sources of air pollution to potentially social determinants of health. We're going to walk through each of those pieces together. That's the second step, is where a facility would need to assess its impacts to these stressors. That list could be a little bit more focused or narrow for a smaller subset of stressors that might be more appropriate for facilities to assess their relative contribution. I just want to give that as a little bit of a framework for conversation. And we will, in the stakeholder session to follow the next one, so the second stakeholder session after this one, we're going to dive in really deep on exactly what that process will look like. But I just want to provide that as a framework for discussion to give folks a frame of reference as we're going through each of these different things. So how exactly are we going to define these stressors? The first step is we have generated what we're calling kind of a brainstorming list of stressors. And to do so, we looked at past efforts that the department has conducted, like our 2009 preliminary screening method that was used to estimate cumulative environmental impacts, a similar effort in 2012, as well as the stressors that are discussed in our EO23 guidance, Furthering the Promise, and other tools that provide similar data like EPA's EJ screen and California's Enviro screen, as well as taking input from our internal program stakeholders, as well as input from external stakeholders, including some of the subject matter experts that Olivia mentioned earlier. As with any good brainstorming, we tried not to edit ourselves up front by evaluating the pluses and minuses and discarding any potential sources of data at this point. So you're going to see a rather broad list, and we're going to walk you through how we view some of these particular stressors and ask for your feedback. Because this session is essentially part of that brainstorming effort. It's a working list. So again, if you see stressors that we have not hit on, particularly ones that you may have submitted comments on, please let us know that we've missed them, and we'll certainly take them under consideration. As we move forward, we're going to work to whittle down this brainstorming list to something that is appropriate and usable for the rulemaking. I think our overarching philosophy here in trying to develop a defensible and implementable rulemaking is to use the minimum amount of stressors that are necessary to do the proper evaluation. There is no number to put on that, but we do not want to add more stressors than are necessary in order to make the appropriate determinations of whether a facility is overburdened. So we'll talk a little bit about how we're going to go through that. So to do that, we're going to be looking at the availability of data. We'll be looking at the quality of that data. We'll be looking at whether that data is usable on the appropriate geographic scale. Remember, the assessment of whether a community is overburdened is done on a census block group, which is a very small and finite finite geographic unit. So we need any data to be able to be usable on that scale in order to make the comparisons that we need to make in order to implement the bill. We're also looking at our ability to quantify that data. And lastly, this is what I was talking about with kind of trying to select the appropriate universal stressors, is that marginal value. And that requires a sensitivity analysis for some of these stressors, where we may have some that are particularly and clearly important. Adding additional stressors that may overlap in some way may not lead to materially different results in terms of being able to do the analysis we need to do. So we'll be looking at each stressor through that type of lens. Like we said, we'll be going through our brainstorming list today, and there's three overarching questions which Olivia touched on earlier, but we wanted everyone to keep in mind. First, what did we miss? What stressors are you not seeing on this list that are important? What should we remove? Do you have, in your experience, professionally or otherwise, have reason to believe that a particular stressor that we're talking about might not be reliable, might not have that marginal value that we're talking about, or might not be scalable? Any of those things that are considerations as we make determinations of what to include and what not to include. And then lastly, and potentially most importantly, what stressors do you see as being particularly important or critical to this effort? That is really where we want to focus. We want to focus on the critically important stressors and use them wisely in the process. So I would just, as we move on to the next slide, I'm going to stop on occasion for questions, but I would really encourage folks to not be shy. As we're going through any of these points, please just raise your hand. We'll stop, we'll talk, we'll answer any questions that might arise as we're going through. I'd like this to be as open and as informal a conversation as we can have under the circumstances. So please don't hesitate for me to stop when you think any of those questions or any other question is something that you'd like us to talk about. And I think we have our first question, so perfect.
Okay, Ray Nichols. Make sure you unmute yourself.
Should be the little microphone button at the top, Mr. Nichols, that you should be able to take so it doesn't have the slash through to it. I think there you go.
I think so. Can you
There you
hear
go. Yes, we can now.
NJ DOT when they do environmental impact assessments always include noise as a dimension for a stressor. And so I would suggest, given the kinds of facilities you're describing, they are noise generators, some more than others.
Certainly, and I think we'll be making reference to that as we walk through. But thank you. Absolutely.
That's all.
Thank you, Ray. All right, so let's start with one of the big ones, concentrated areas of air pollution. So this topic and kind of our initial surveys certainly generated a lot of feedback as to what should be considered as part of a concentrated area of air pollution assessment and what should be included in our list of stressors. And we've looked again at similar works and similar efforts such as EPA's EJ screen and California's Enviro screen to start to develop this list. To organize the conversation, none of these organizing principles are dispositive, but simply just to help us to get our minds around this topic because it is a big one and a broad one. We've kind of organized them into 4 categories. First, pollutants. Second, emissions or releases. Third, air quality measurements, and fourth, modeling. And we'll walk through each of those. The first category focuses on pollutants covered, and that is multi-tiered and multifaceted approach that we could take here. First, we could look at criteria pollutants, and those include 6 pollutants: ground level ozone, particulate matter, carbon monoxide, lead, sulfur dioxide, and nitrogen dioxide. And these are particular pollutants that the Clean Air Act requires DEP to set national, and for which the Clean Air Act requires EPA to set national ambient air quality standards for those 6 pollutants. They are commonly regulated, and they are found all over the United States and tend to cause both environmental and public health harm. For reference, EJ screen and Cal Enviro screen focus primarily on 2 particular criteria pollutants: ozone and PM 2.5. We also are considering looking at using hazardous air pollutants, which includes a list of 187 toxic air pollutants regulated under Section 112 of the Federal Clean Air Act. We've also been asked to and are considering whether it's appropriate to use diesel particulate matter. While not a criteria pollutant or a hazardous air pollutant or HAP, it is identified as a mobile source air toxic in EPA's 2007 hazardous air pollutants for mobile sources final rule. So that's something that's certainly on the table. We've also been asked to consider for inclusion ultrafine or black carbon, as well as greenhouse gases. Greenhouse gases are defined under the Global Warming Response Act to include carbon dioxide, methane, nitrous oxide, hydrofluorocarbons, perfluorocarbons, sulfur hexafluoride, as well as any other gas or substance that the department determines to be a significant contributor to global warming. So that's kind of the list of pollutants, at least initially, that we're looking at potential inclusion in our analysis. The second category we're looking at is emissions. DEP tracks emissions data for both actual and allowable emissions. Actual emissions from point sources, which are typically large stationary sources of criteria pollutants, and 36 toxic air pollutants are reported by facilities under our emission statement program. Actual emissions of additional air toxics are reported under New Jersey's Release and Pollution Prevention Report and EPA's Toxic Release Inventory. So we have information on both of actual emissions from multiple sources. We also have data on actual emissions of criteria pollutants from other source types, such as area sources, which are typically defined to include smaller stationary sources, and on-road sources as part of the National Emissions Inventory. In general, emissions from these sources are developed at a state and sometimes county level. The NADA, or the National Scale Air Toxics Assessment, uses spatial allocation surrogates to allocate county emissions to a finer geographic scale. So there is some precedent for taking a broader coverage for some of these stressors and narrowing it down to a finer scale. We also track allowable emissions, though those emissions are not typically aggregated and evaluated statewide as routinely as actual emissions do. Those allowable emissions are essentially the permit limits, where your actual emissions are what the facilities are actually emitting on a day-to-day basis. We've also been asked to ensure that fugitive emissions are included in the evaluation of air stressors. Fugitive emissions being any air containment emissions released directly or indirectly into the environment which cannot reasonably pass through a stack or chimney. Essentially, you're kind of, let's call it, point source of air pollution. Fugitive emissions are included in the emission statements for point sources and the emission inventory for other source types. So we do have information on that as well. We've also received a few suggestions to quantify and aggregate emissions on a density basis. For example, calculating emissions in tons per year per square mile. And this can be done for our point source inventory, where we know the detailed locations of the site. And this would be, if we choose to go that way, and subject to feedback we receive tonight and moving forward, a simple way to quantify releases compared to a more detailed modeling that is done for an air quality evaluation, which we'll talk about in a moment. I think this is a good point. I forgot at the earlier session, but I'm going to say it now. I just want to remind everyone that this process is iterative, that we recognize that we present a lot of information, some of it highly technical, some of it may seem like environmental jargon. I'm still trying to learn how to communicate it as clearly as we need to. So as you have time to digest this, particularly if things don't arise to the level of wanting to ask a question tonight, we're open to continuing to receive your written comments after tonight's meeting. We're open to continue this conversation for folks to continue to talk to us as you have an opportunity to think about this more. So I don't want folks to feel completely talked at for this evening without feeling like there's going to be an opportunity to provide meaningful feedback as we move forward. So let's move on to the third category of comment which is air quality measurement. And the department currently operates 30 air monitoring sites throughout the state. Not all monitors collect data for the same parameters, but collectively, those network monitors who generally monitor for 6 criteria pollutants, air toxics, as well as other weather-related parameters. Stakeholders commented that more local monitors and neighbors would be useful if located with input from the communities. So we have some monitoring data, but where we don't have monitoring data, where that data is not complete, modeling can be used to fill the gaps not covered adequately by those monitors. So I think that naturally takes us to the fourth category for this sources of air pollution conversation, which is modeling. Certainly not practical to locate sufficient monitors to track all we would need to track in each overburdened block group. But the DEP, EPA, and other states will use various computer models to evaluate air emissions and air quality. And they're too numerous and too detailed to really address completely here. But we've listed some of the key approaches. Most of the other tools that we've looked at are similar to the tool that we'll need to implement the environmental justice law. Those rely on some form of air modeling, though they take different approaches. So what's interesting to note here are 2 key tools and the differences between them. So EJ EnviroScreen and California, or excuse me, EPA's EJ Screen and California's EnviroScreen. Those are 2 of the most well-known and widely used tools. So for the criteria pollutants of ozone and PM 2.5, EJ Screen uses a hierarchical Bayesian approach developed by the EPA and CDC, where California EnviroScreen uses interpolation approach. And I was very, very poor at math in school, so I'm going to try to explain this in a little bit more basic terms. Basically, what that means is that the EPA EJ Screen uses a more complex statistical approach that combines monitoring results with modeling results. California takes a similar approach that uses interpolation, which in simple terms is used to estimate values between 2 known values. So they would take kind of 2 values and estimate what they think that is. I think what's important to note here is that there are many different ways to get to this outcome. You can use modeling, you can use monitoring, you can use a combination of the 2, and you can apply different statistical approaches, different mathematical equations to that to make sure that you're getting to the outcome. But there are a lot of different ways to get there. And certainly interested to hear opinions both tonight and moving forward as how folks might view these different tools, might view these different statistical approaches as what they think is the most appropriate way to go about it. So the next topic for conversation. Oh, we have a question, which is perfect. I can catch my breath.
Go ahead, Nancy.
Okay, thanks. I've done some modeling myself, and listening to this, I'm wondering how applicable the results of the modeling would be at the census block level. And just a comment, it would be good to know how they validate their models. After you create a model and you run it a bunch of times, you go and look at reality, so take some points from reality and match them against what you got in your model. It'd be good to know how they did that and what they got when they did that.
Thank you. I don't necessarily have an answer to that sitting here today, but I think those are both good things that we need to focus on. Obviously, we have our data folks are on the line, and I would invite them at any point that they feel appropriate if they want to jump in on any of these. But thank you, Nancy. Those are good points, and we're certainly looking at those issues, obviously the reliability and being able to validate that data, as well as being able to scale it to the appropriate level so that it's usable for the comparison we need to make here. So the next part of this conversation is a focus on mobile sources of air pollution. Mobile sources have impact at the global through greenhouse gases, regional level through ground level ozone, as well as local through near road hazardous air pollution, hazardous air pollutants, and PM 2.5. So you're really talking about an issue that is multi-tiered. Mobile sources represent the largest source of air pollution in New Jersey. Cars, trucks, buses, off-road construction vehicles, locomotives, marine engines, and planes all are considered mobile sources of air pollution. Now, while emissions from any individual vehicle may be relatively low, it is the abundance of these that create issues, particularly in overburdened communities. So DEP estimates emissions of criteria pollutants from various road and non-road mobile sources as part of the National Emissions Inventory at the state and county level. EPA's national scale air toxic assessment estimates on-road and non-road mobile source releases for HAPs and diesel particulate matter. So again, the data is there. We're also working with partner agencies such as NJDOT and the 3 metropolitan planning organizations to develop additional data to address mobile source stressors. So a couple of things that, in addition to that direct data, that we're thinking about using to try to fill any gaps that we might have from a data perspective, are some kind of present conditions again. So one is major roads. We have substantial information on the use of major roads that could allow us to evaluate traffic. For example, NJDOT maintains a traffic monitoring program consisting of continuous and short-term elements, while the Federal Highway Administration has the Highway Performance Management System that includes similar information. So we have information about the use, about congestion on some of these major roads. We've also been asked to consider the use of non-major roads, right? Recognizing that overburdened communities may be near one of our major highways, but they also may be near other roads which generate significant amounts of traffic, which again would generate significant sources of a mobile source of air pollution. So we are potentially looking at non-major roads. So those would be generally kind of your county series 400 or lower, where there is less information, but we're certainly taking that request seriously and seeing what we can do there. Other source types that we've heard from stakeholders that should be considered, because not everything is on the road, as we've talked about, but these are areas or particular types of uses which tend to concentrate mobile sources of air pollution. So while they are not stationary sources, they are situations where there are abundance of mobile sources which are creating emissions issues. So some of those include railroads and rail yards, airports, buses and transit stations, ports, and warehousing and distribution. So what we'd be looking at is the presence of those and ultimately the proximity of overburdened communities to those and trying to make some calls there. Distance and proximity to roadways within 500 or 1,000 feet is also something we've been asked to look at and something that we are looking at. So we've covered a lot of material on stressors related to air pollution and mobile sources, and I thought might be a good time to pause again to try to answer any questions anyone might have or comments that folks would like to make. As we're doing that, up on the screen, we've included a table comparing the approaches used on these topics from EJ Screen and Cal Enviro Screen for air and traffic. It might help the discussion, and I think folks might have an opportunity when you get out of this room to kind of look at this and see some of the specific points of comparison between the two tools as they deal with this information. A couple of takeaways here is one, air is, as we've talked about, is an important and complex topic, but both approaches cover air issues with relatively few indicators or stressors, which is certainly an interesting takeaway for us. Additionally, some form of modeling is used to estimate impacts from air pollution. So across the board, whether you're using an interpolation or a Bayesian approach, you're going to be filling in some of the gaps with modeling. For traffic, surrogates are often used, such as traffic density, instead of direct emissions or modeling. So that then goes to things that we've talked about already, being able to evaluate the proximity of major roads and their use. So those are some of the things that we've taken away from our kind of comparative approach, attempting to dig down into available tools, as well as working to develop our own methods. So I'm just going to pause for maybe 30 seconds and see if anybody else wants to raise their hand I know that the air pollution conversation is an extremely important one for us to have, so we want to leave some space for folks if anyone would like to comment at this point.
Okay,
Excellent.
Dr. Sheets.
Dr. Sheets, good evening.
Hi, good evening. Hope you all are doing well. With
It's good
respect
to
to air
talk.
pollution, I noticed that you listed ultrafines and black carbon, and you had them listed, it seemed like, as the same thing. And I think some distinctions can be made between them. So what are you thinking there? Are you thinking about using one or the other or both? I don't know how much data is available on them. Yeah, so that could be an issue, but to the extent that you could find data on one or the other, how are you thinking about handling that?
Yeah, I don't think I necessarily meant to lump them together as being the same thing, but I certainly, I'm going to ask, Steve, are you there? Is there anything you feel like you want to add here?
I am, but honestly, I do not know that much about what's going on with black carbon and ultrafines. I would need to defer to the people doing the pact rules and so forth, and more up to date on that.
Okay.
I mean, at this point, I think focusing on at least diesel, we're getting at least some of that, as I understand it. But I would need to defer to to others on that, to be honest.
Peg Hanna, I think you might be here. Peg, is that something you'd like to weigh in on?
Hi there. Yeah, I not quite sure I'm qualified to answer it from a
Oh,
technical
sorry.
perspective.
Okay.
From a technical perspective, but also in response to what Dave put in the chat box, he's absolutely right. Black carbon is a short-lived climate pollutant, and part of what we're looking at. I think a lot of the NJ pact rules that we're hoping to move forward with shortly for transportation will reduce black carbon as well as greenhouse gases. So to the extent that that gets at the question, that might be helpful, but I can't directly answer Nikki's question about ultrafines versus black carbon and what is the percentage, what the percentage of ultrafines and black carbons is.
Okay, thank you, Peg. Sorry, I didn't mean to put you on the spot. So I think, Dr. Sheets, I think what this really highlights is this is something that we're looking at, and we're going to need to talk to you further as we continue to work through this, looking deeper at the data sources to have some more conversation about how we're going to treat those two things.
Okay, thank you.
No, thank you. All right, let's move on to the next thing. Keep going. So one of the other things that's listed in our environmental justice law, and another thing we need to look at, are contaminated sites. I think generally everyone would kind of understand what contaminated sites are. There are a couple of different nuances here in terms of how we look at them and what could be considered in an analysis of contaminated sites. I think what we're likely to see here is potentially kind of a density analysis in a different block group to see kind of what the overall presence of contaminated sites is. So there's a couple of ways to look at this. First, we have a list of known contaminated sites, and that includes cases in the state where contamination of soil or groundwater has been confirmed above applicable standards. So that includes sites where remediation is currently underway, required but not yet initiated, or has been completed. We also have information on deed notices and groundwater concentration areas. And that, the intent of both of those is that these sites, at least from a regulatory perspective, no longer pose a threat to public health, but groundwater or soil standards are met and are not met, and restrictions are put in place. Restrictions, or as we would call them in the environmental world, engineering controls are put in place on the site to essentially restrict its use. So for deed notices, that's a notification that's added to the property's chain of title, indicating that contamination remains above the department's residential or unrestricted soil remediation standards, and essentially requires property owners' consent, specifies the location of the contamination, and how those engineering controls must be maintained and monitored for the protection of human health and the environment. That notice is essentially intended to inform prospective holders of that property of the contamination and the related restrictions on the property. Classification exception areas are the currently known extent are areas where groundwater quality standards have been exceeded, and these notifications are to ensure that the use of groundwater in these areas is restricted until those standards are achieved. What's also relevant in at least in a conversation about contaminated sources is the presence of brownfields. Under the law, a brownfield is defined as any former or current commercial or industrial site that is currently vacant or underutilized, in which there has been or there is suspected to have been a discharge of a contaminant. We also have brownfield development areas, which are essentially groups or aggregations of two or more largely contiguous brownfield sites where remediation is taking place simultaneously. The process of addressing clusters of brownfields tends to lead to a more efficient remediation as opposed to a site-by-site approach, and helps us to kind of both save money from economies of scale on that remediation, as well as hopefully bring those properties back to more beneficial use. Obviously, the remediation of brownfields is important. Like contaminated sites, they can be a threat to public health and the environment, but also because redevelopment of brownfield sites improves the economy, provides jobs, increases ratables, and removes blight. So we certainly want to continue to incentivize the remediation of these sites. So the questions we have here, and if folks are interested in weighing in here, is should we be including areas such as CEAs, classification exception areas, deed notices, brownfields, should those be considered in an analysis of contaminated sites? Obviously, things that are on that known site list would seem to be appropriate for inclusion, but some of these other ones where some remediation has occurred, but potentially it's not complete, or potentially this property is being targeted for redevelopment, it's a question of whether those should be included in this analysis. We're certainly interested in folks' feedback on that either now or at some time in the future. Sorry, I lost my notes here for a second. Moving on to transfer stations, solid waste facilities, recycling facilities, and scrapyards. This is certainly a conversation that we had in a pretty good depth the last time we talked, as we were talking about how we might define these things. But let's kind of consider how we might go about measuring them. So obviously, waste management is certainly an essential component for public and environmental health. But these sites can release methane and carbon dioxide into the air for decades, as well as other stressors, which one gentleman had already brought up already, such as noise. They can have water impacts. They do often involve truck or rail traffic and can cause impacts from noise, odor, and sometimes light. Some of this is addressed in solid waste and air permits, but even when incidents are raised, they sometimes can't be verified or don't necessarily rise to the level of a permit violation, but they do create a nuisance and stress on the community. So we certainly recognize that improperly managed facilities, including scrapyards, can contaminate soils and groundwater, as well as potentially releasing hazardous materials such as hazardous substances such as methane or refrigerants. So what we'd be looking at here is kind of similar to how we were thinking about contaminated sites. We would be looking at available data we have. Obviously, we permit many of these things, and being able to demonstrate some level of kind of a density analysis in an overburdened community to make an assessment of the presence of these facilities. In addition to solid waste facilities, which are specifically mentioned in the bill, facilities covered by the law and that have otherwise been identified as stakeholders could be considered. So what we've talked about, these facilities include major source of air pollution, resource recovery facilities or incinerators, sludge processing facilities, combustors, incinerators, sewage treatment plants, and solid waste facilities, including medical incinerators. So those are other things that are covered by the bill, which we'll certainly be looking at. There are also other facilities that we've been asked to look at that, while they're not specifically mentioned, can lead to stressors in the communities, and we're taking that seriously. And those include other major regulated sites, while not specifically called out in the bill, but that might be subject to our Toxic Catastrophe Protection Act processes or discharge prevention, kind of like chemical or petroleum facilities, which, besides potentially being major sources of air pollution, might not be directly covered. So those may bring stressors to the community, and we're certainly looking at those. For a bit of background, things that are covered by the Toxic Catastrophe Protection Act are facilities where if there is an accident, it can cause significant harm to the surrounding community, And those, we look very closely at the safety aspects of those facilities. We're also considering other solid or hazardous waste facilities that are not specifically covered by the law, but that might contribute stressors. Again, as we said, we could consider the density of these facilities as a stressor. Living in close proximity of facilities is known to bring sources of truck traffic, dust, odor, noise, and even where they're not directly confirmed by our compliance and enforcement staff could be considered stressors through fugitive emissions, unconfirmed emissions, odors, all of those things. So moving on to point sources of water pollution. Now, the department does track information related to point sources as well as combined sewer overflows. Discharges from point sources are reported on discharge monitoring reports. For combined sewer overflows, DEP tracks discharges and maintains an interactive mapping tool. So we're able to assess both your kind of direct point sources as well as those CSO overflows. We also address in-stream water quality, and that has recently been added as an interactive mapping tool for our integrated report. And I think we're going to be putting some of these, some of the things we've referenced here that are on our website, we'll be dropping them into the chat for folks to look at their interest or when they have some time. Turning to how other tools address water pollution. So EPA's EJ screen uses a risk screening environmental indicators, or RISI. And as my friend Steve explained to me, that is that invokes the peanut butter and chocolate candy, which I will hope to have some after this meeting, as a model for point sources. The RISI model calculates values that reflect the risk-related impacts on chronic human health of modeled chemical releases and transfers. For the EJ screen, it has a wastewater discharge indicator that adds discharges from that DMR data that we talked about before. CalEnviro screen, the 3.0 version, focuses on in-stream water quality and the number of pollutants across all water bodies designated as impaired on the 303D list of impaired water bodies within an area. So a couple of different ways to look at it. You can be looking at water quality, or you can be looking at direct discharges. Again, multiple ways to get at this information, and multiple ways that we are looking at how we might be able to establish the right information, the right data sources to demonstrate the presence of these stressors. So this is where we kind of take a little bit of a different tact. If anyone has any questions at this point, we've kind of gotten through the conversation of environmental stressors. We're going to start talking about the public health stressors now.
Hey, Sean, we'll take a break really quickly
Yeah.
to get a question from or comment from Joanne Held.
Hi, thank you. Going back to your the solid waste management facilities, I think one important source category that tends to be under the radar, and you sort of have it there, you've got scrap yards. They don't have air permits. They probably may not have water permits. They may just be dumps, and they're hard to quantify, but they are right there next to the people. So I think you want to make every effort to find a way to somehow maybe find a surrogate for them or some other way of including them, because they're right next to the people and could be posing lots of different risks.
Absolutely. Thank you, Joanna. And I think one of the takeaways that we had from our prior meeting, particularly the discussion of scrap yards, certainly opened my eyes to how we need to focus more on these, and we're certainly looking at ways to do so, as well as the appropriate ways to quantify that data. So thank you.
Okay, thanks.
Thank you, Joanne. Next, we have Natalie Augusto-Filion.
Hi, I'm using a headset. Can you confirm the sound quality is okay?
Absolutely. Perfect.
Okay, awesome. Thank you. The question that I had has to do with the idea of sort of cumulative burden of these impacts. And I had a couple thoughts. One related to the chart that you displayed of EJ screen and CalEnviro screen. And the simplicity of the layers that were provided there. I definitely understand the value of that. And I also would sort of push us to consider the fact that New Jersey is a much smaller state with much higher density. And therefore we could presumably, in what time frame is really the key question here, but it's more possible, I think, for New Jersey as compared to California, and certainly as compared to all of the country, to develop the necessary data layers, or the data layers that would most effectively help us get at the the questions that we're trying to answer. And so I see the idea that we can sort of use proxies like traffic, for example, as there's some value in that simplicity in terms of being able to explain what the analysis is based on, particularly to the regulated entities. But I also think that because we're first in the country doing this, that we're in a position to really sort of lay out what's possible when it comes to this form of analysis, and take the next step in this sort of fight that many of our communities have been in for decades to get to the place that New Jersey's in today, right? So I really commend the department for all of this effort, and want to just flag that maybe we not sort of let ourselves just follow the EPA and the California model, because we're a different place with a different set of needs because of how many people we have living so close together and so close to these historic industries that really started here, right, on the East Coast. The other thing that I wanted to flag has more to do with the question of the cumulative burden, and I'm channeling Dr. Sheets here, so I'll invite him to speak up after me if he can correct or add to what I'm going to say. Newark has an environmental justice and cumulative impacts ordinance that mandates that we have our development applicants provide responses to a set of question prompts about cumulative burden. But I think where we've fallen short and what we're exploring internally is this question of how all of those different pollution sources come together in terms of the impacts on the population. So the reason that I chatted into the chat thread here that we were taking each thing sort of by turn is that I think it'll be important, essential, critical for us to bring those various kinds of exposure pathways together to recognize that the cumulative impact of all of those in communities that experience multiple of those, such as my own. Thank you. Sorry, I went over time.
No problem. Thank you. Excellent. I think in response, I would just offer that your point about not simply following California or EPA is certainly well taken, and I don't think we aim to blindly follow what anyone else is doing. I think we really just want to kind of explain the depth that we're looking at this, and to give folks an idea of where kind of some of the touch points or points of comparison that we're looking at, because we also don't want folks to feel like we're just kind of making it up on the fly. Certainly trying to make sure that people understand that this effort is as informed as it can be. And the question of simplicity is certainly something as the lawyer, right, is important, because I want to make sure that whatever rules we have in place are defensible and implementable, because I think that an overcomplicated approach may ultimately be counterproductive. Now that is not meant to say that we would be taking any shortcuts in that analysis. When I say the minimum amount necessary, my focus is not on minimum but necessary. And it's a focus on making sure that we have absolutely the appropriate number and types of stressors to be able to do the analysis that this law demands us to do. And that's that cumulative and disproportionate impact analysis. And we will do nothing short of using the absolute appropriate and necessary information that we have available to us. And I would say that we're going to do a series of rules, or we're going to do a rule proposal this year. And that beyond that, as data continues to become available, as we are able to kind of continue to further this work, the things that we look at in 2021 or 2022 may change in the future as we're able to have better data and continue to build on this. So this is our first step, not our last step, and we'll be continuing to evaluate information so that we make sure that the environmental justice rules that are in place at any time are as protected as they can be. So thank you for both of your points.
Thank you, Natalie. Next, we have a hand raised by Ray Nichols.
Thank you. Can you hear me?
Yes, sir.
Okay. I'm going to go back to mobile air sources and how you're determining the contaminants that they generate. And the AADT, average annual daily traffic, that's generated either by the feds or the state DOT, is looking at individual roadways. But New Jersey, in addition to being a relatively small state with the highest population per square mile, also has the most lane miles per square mile of any state in the country. So in that sense, it's quite different than California, which is a big state, and although it has a lot of roads, they're not that dense. And so you can have multiple roads, consider the roadway or network around Newark Airport, different highways, different designated highway numbers. Some are interstate, some are state, some are county, some are local, but they're in such close proximity that the air pollutants generated are cumulative. And the only way you're going to get at that is by having monitoring in those locations. The modeling is going to be inadequate because it's not going to be able to do the cumulative impacts. Maybe over time you can develop those models, but then you still need to have need to proof the models. You need to have data that shows the models are good or not. That's all.
Thank you, Ray.
There were a couple of questions that were submitted in the chat.
Kind of scroll back. I think we addressed these. All right, I think it's post after Dave. Okay.
Dan Van Abs at
Yep.
6:43.
Can CEA and CKE involve contaminants beyond the originating site, potentially involving the movement of gaseous contaminants into buildings? It isn't just an issue of water pollution for potable uses. Yes, vapor intrusion absolutely is something that can result from these, and I think that's one of the stressors that might be under consideration. I think what we're trying to point to here is essentially kind of the presence of those sites and how we should be considering those from a density perspective. But I'm certainly not separate and apart from what stressors they might bring to a site. So that's certainly something that we would be looking at. And thank you, Dan. Rachel Dawn, were there cumulative psychological stressors included, climate and mental health connection measurements, depression, anxiety, increased coping behaviors? There are increasingly ways to help communities prepare and mitigate inevitable ongoing climate pollutant-induced stressors. So that is not something that was on our list, but it's certainly something we're going to add to the brainstorming list and take under consideration. So thank you very much, Rachel. Lee Clark, are stressors such as the community's proximity to hospitals and accessibility to hospitals also being considered? We're going to talk about a little bit of that as we move into public health stressors and talk a little bit about social determinants of health, but those or something closely there related there too are certainly on the list of things we're considering. And then Christian, are odors part of the stressors? Yes, I think they will be. Certainly something we're looking at. We see the presence and consideration of odors on multiple of the facilities that we've been looking at, so that's certainly something that's on our list. I think that gets through the written questions, and we will continue on.
Before you continue on,
yes,
we do have one more raised hand from Dr. Sheets, so we'll let him be the last one, and then we'll move on.
Thanks, Olivia. Sean, I have one for you and Olivia that's been nagging at me for a while. And several of the questions are kind of getting to it, and maybe you're going to come to it when you say social determinants of health.
Sure.
Have you considered other things besides physical conditions that may cause health impacts? And in particular, I'm thinking of race, income. I know that race and income have been used to define overburdened communities, but you could also see including them as a stressor. Like the higher the percentage of people of color in the neighborhood, you could see that they would face more racial discrimination, or the higher the level of poverty in the neighborhood, could have an impact in a number of ways on on their health. And you could extend that to, Lee was talking about accessibility to hospitals. You could look at unemployment rates in the neighborhood. You could look at the rate of health insurance coverage in the neighborhood. Those kind of social, we would probably call social vulnerabilities, and include them in some kind of cumulative impact evaluation of score. And particularly the race and income, though, I was interested if you have considered that.
Yeah, those are on the list, and we'll get through those. Actually, was something I wanted to talk to you specifically about, because I know that your work touches on this a lot, and what you had mentioned about about a higher percentage is something that is interesting. I had kind of had that same question that you kind of posed and then answered, since those kind of demographic criteria are used to define the OBC, whether there was more to be done there. But I think you've answered that. So that's something that we'll take back. Thank you, Dr. Sheets. Okay, so on to the next part, and we're kind of focusing a little bit more on public health stressors now. Again, those conditions that may cause potential public health impacts, including those enumerated examples. So it certainly would make sense to look at actual health outcome stressors, especially those listed. We've heard from many of you that would like to see us consider certain outcomes like low birth weight, infant mortality, emergency department visits, asthma rates, cancer rates, and community health studies. And the department has and continues to work closely with our partners at the Department of Health to evaluate health outcome data that may be related to environmental exposures. Just one thing to point out here, and certainly not dispositive, but in the spirit of discussion, due to confidentiality concerns. So again, the HIPAA forms that we all sign to protect our privacy when we go to the doctors, and statistical stability issues related to working with smaller numbers of health cases at smaller geographic scales. We really have to look closely at the data that we can ultimately obtain from Department of Health to ensure that it is, one, able to be used publicly, and two, able to be kind of statistically validated down to that small geographic scale to make it usable. But again, the department is going to continue to work with DOH on this evaluation to determine what of that information will eventually be usable now. And as I said earlier, continue to evaluate that for potential future adjustments to the rulemaking after we're able to move forward with our first round. So in addition to that, let's take a look at some of the things that might cause potential public health impacts. Again, present condition things, and we'll talk a little bit about some of the additional things that Dr. Sheets had mentioned as what we were calling social determinants of health. So it really kind of brings us back to things such as ozone, which contributes to asthma, PM 2.5, which can contribute to cardiovascular disease, and to the national scale air toxic assessments related to cancer and non-cancer or respiratory health outcomes. That data exists. We think we can use a lot of data on those things to address some of these stressors. We can also consider drinking water standard exceedances for community drinking water, as California does, and non-community drinking water systems, as well as private wells. We have data to talk about water quality that folks are drinking. We also are looking at proximity to pesticide applications like large agricultural areas, which is sometimes considered a stressor. We don't necessarily have at this point a complete set of pesticide data, but we're going to continue to look and pursue that path. As I've mentioned previously, and kind of shorthand for some of this is age of housing, and that's typically included as a surrogate for elevated child blood lead, since old paint, before we all knew any better, is high in lead, and the paint and dust from those surfaces are primary sources of lead exposure, which we all know is particularly critical to avoid in children of young ages and can lead to developmental difficulties moving forward. Then there are naturally occurring environmental stressors, which we could consider. Things such as radon, which is the second leading cause of lung cancer, or arsenic, which is also a known human carcinogen, which can contaminate private well water. Now, those things are naturally occurring, but above specific levels, they can be very detrimental to health, and that's something that we could be looking at as part of this analysis. We can also look at the lack or absence of environmental and public health benefits as part of this process. Now that would be things such as lack of open space, lack of tree canopy, the lack of pervious surfaces, bicycle or pedestrian corridors. All of those things contribute to the health and safety benefits like reduced heart disease, heat-related illnesses, diabetes, and obesity. And those are things that were specifically mentioned to us in response to our surveys from some of our stakeholders. We maintain a thorough inventory, obviously, of open space, and the USDA Forest Service has really good tree canopy data. We could use some of that data to overlay with the overburdened communities to make some assessments of some of those conditions and particularly the lack thereof in certain communities. And I think we would consider the absence of those benefits to be potential health stressors. And then we go on to our conversation of social determinants of health, which was, again, previewed by Dr. Sheets. There are several definitions that people might use when they discuss social determinants of health. Today, we're going to cite the definition used by the Federal Centers for Disease Control, and they discuss social determinants of health as conditions in places where people live, learn, work, and play that affect a wide range of health and quality life risks and outcomes. CDC tracks progress with improving these social determinants of health through their Healthy People programs, as they recognize that they can have influence on population health outcomes. So many stressors could be included in a list of social determinants of health. Some of the stressors from the previous slide can be moved here. And here are some of the ones that were typically used in other similar efforts, as well as some raised by stakeholders. And this kind of goes into a little bit of detail here, but I'll pinpoint some specific ones that are of interest. Age, as we've talked about, certain populations like certain children are more susceptible to detrimental effects from lead, whereas individuals over a certain age, potentially over 65, are also more susceptible to the health impacts of some of the stressors that we've talked about. We can also look at things such as social vulnerability index. The CDC social vulnerability index includes U.S. Census data to determine the social vulnerability of every census tract. The CDC SVI ranks each tract on 15 social factors, including poverty, lack of vehicle access, crowded housing, and it groups them into categories. That is meant to help public health officials and local planners better prepare for and respond to emergency events like hurricanes, disease outbreaks, or exposure to dangerous chemicals. But that data could be equally or also appropriately used in an analysis of stressors in overburdened communities. Other things that we've heard and we're looking into, education levels, and percentage of individuals within a specific block group that have less than a completed high school degree, unemployment rates, rates of individuals that are disabled, single family households, carless households, household energy burden, which is essentially the percentage of income that individuals in a block group spend to heat and cool their homes, the percentage of population that is lacking health insurance or access to health care, lack of maternal and prenatal health care, lack of access to healthy food, sometimes called food deserts, lack of access to quality public housing, quality public transportation, or lack of access to clean energy alternatives. I think as part of this, to Dr. Sheets' point, race and income are things that certainly could be considered here. In addition to the definitional part of the bill, and as we talked about in response to one of the questions, mental health and other stressors could be included in this conversation as well. And now we get to essentially kind of our last slide, and then we'll open up the floor back for questions. But we've been asked to consider stressors related to climate change, and those include flooding, sea level rise, increased temperatures, and all of those, as the department has said repeatedly and will continue to say, cause public health and safety impacts for all of us, particularly those in our overburdened communities. So certainly interested in folks' thoughts on this, thoughts on all the things we've gone through, the inclusion of natural occurring stressors, the inclusion of any of those social determinants of health, and things such as lead paint, and it really pretty much anything that we've raised so far. I'd like to kind of take as much time as we can to continue this conversation for folks who might have questions or comments.
So we have one hand that's already raised, and it is Renee Pollard.
Yes, thank you. I just want to go back a little bit to your environmental listing on your previous slide. You had on the listing the age of housing. Is that related to infrastructure for instance, lead water lines, things like that, could be aged on reference to the house.
Yes, I think that would be something that would be included. I think there may be some overlap there in terms of how we would look at that, but I think generally speaking, age of housing is certainly can be indicative of lead service lines as we are moving forward with our lead service line replacement program. We may have additional data that might inform that more directly, but I think you can be able to make some potentially make some conclusions from age of housing with regard to things like infrastructure and service lines and other things for sure. Yeah. And we'd certainly be looking at that, whether it ultimately becomes reliable enough to be included in the rulemaking. We'll discuss that further as we move forward.
Okay, thank you.
Absolutely.
Okay, next we have John Reichman.
Hello, how are you? Can you hear me?
Yes, sir.
Oh, great. Thank you. Hi, I'm the chair of the Wave Environmental Committee. I'm on a steering committee of Empower New Jersey. I think it was Olivia, you mentioned at the outset of the program that that the statute only becomes effective when the regulations are fully adopted. This obviously is presenting a real problem. I think, as you know, there are a number of very large facilities where permits are being sought in overburdened communities, including the biochar plant in Newark, the frac gas plant in Newark, the gypsum plant in Camden. So my question is, what are you going to do to prevent, I think as the governor said, these potential polluters and polluting sources jumping the line and making sure that, consistent with the spirit and purpose of the EJ law, that they are subject to the standards and the spirit of the law? Are you, for example, thinking about adopting emergency regulations? And if you could also tell us, give us any more input with respect to when you expect to have final regulations.
Sure. I will take the last of your questions first, and then we'll address the question of current applications. So we aim to have regulations proposed by the end of the third quarter, and as early in the third quarter as possible. We're looking for kind of the late summer or fall to have these regulations proposed as we continue to move through the stakeholdering, and then as soon as possible thereafter, after we get through the public comment process and are able to address the comments, which we expect to be substantial, we will propose those regulations. I can't specifically put a time frame on that other than as quickly as we are able to. With regard to what the department is doing with applications that we have in-house, as Olivia indicated, unless and until the regulations are in place, we really cannot deny applications based strictly on their being cited in overburdened communities. That is not stopping us, and Acting Commissioner LaTourette has made this clear both I think publicly as well as directly to applicants, that we expect those applicants to work with and address the concerns in the communities broader than simply what we would otherwise permit. So we are requiring and essentially demanding of applicants to look at their facility-wide impacts to stressors and to address them. We cannot speak specifically to any permit outcomes at this point because that would be premature. But our goal and our effort in this regard is to work directly with applicants to address the concerns of the communities in which they are seeking to be cited. And if they cannot do that, that will be a decision for the commissioner to make about whether we do or do not issue permits for those.
Yes, so just to follow up on that, are you going to allow any community input into that permitting process?
Absolutely, 100%, no question. I mean, we've extended the comment period, and we'll be holding a public hearing on the gypsum issue. There will be extensive public comment. There will be a public hearing that we will hold on any permits related to the other facilities that you've mentioned. We've also spoken specifically and directly with some of the interested groups that are related to those facilities, and offered both to work with them to facilitate the receipt and transmission of their comments, and to facilitate any conversations that they would like to have with those applicants to make their concerns clear. Certainly cannot mandate that folks speak with applicants, though we have encouraged and offered our support in that effort.
Thank you, John. Next, we have a hand raised from Ann Bastian.
Yes, I wanted to know if you were going to consider the lack of a local democratic process in the zoning and development as a social stressor. I guess you'd have to call it a political stressor, but it is a social stressor in our community in Piscataway. And in other words, we're talking about disclosure, opportunity for public comment, advance notice of agendas, advance notice of resolutions, advance notice of applications for waivers. We have a very specific case that's now at the DEP with the Wetlands Division, but it really is, in our view, an overburdened community case that we'd also like to submit to the EJ Division. And we want to know, how do we do that? And why wouldn't that be considered, the violation of a public process or the lack of democratic input as a social stressor in dealing with some of these, in our case, enormous number of logistical centers that are being placed next to schools in our community?
Sure. So, I mean, I think it would be difficult for us from a data and data perspective to be able to use that information to make some of the determinations we need to make. I think the way that that the environmental justice law intends to get at that issue, and the way that we would certainly intend to get at that issue, is through an appropriate and robust public process in advance of any application in an overburdened community. And the law specifically calls for a public hearing in the overburdened community. It calls for the development of an environmental justice impact statement that is required to reflect the comment that has been received at that public hearing, and will ultimately be requiring applicants to address and respond to those comments. So I think, to the extent, you have issues at the local level, it's not something we can necessarily address, but we certainly can address from a state permitting level to ensure meaningful public participation, to ensure a connection between an applicant and the concerned individuals in a community, to ensure that their voices are heard and their comments are addressed and essentially reported to the department, so we can consider whether those comments and concerns have been adequately addressed in a permit application. So
that makes sense. You're creating a kind of guide to due process for
yes.
the community in these things, and that's very important. But am I right in understanding from this conversation that will only apply after this process is done? What about applications that are pending now?
We're looking at options in terms of how we can do this, but enhanced public participation is going to need to be a hallmark and a part of applications that are in overburdened communities that are coming in advance of the regulations. So we're going to work to ensure that.
That's actually very good. Thank you.
You're welcome. Thank you.
Okay, we have Ray Nichols. Okay, it looks like he may have put his hand down. So I think that now we can go to the chat.
I'm sorry. Can you hear me now?
We
yes.
can.
Okay. I'm looking at the screen and asking what stressors do I suggest you remove. And I would like to say that you're not the DEP is not the department that can solve all the problems in this world, especially as they relate to poor people. The law specifies that you look at facilities which are carefully defined, and you look at the effluent from those facilities and any existing groundwater contamination, et cetera. You went through that at the beginning. What concerns me is that as the list of social stressors gets expanded, and they are very real, and they tend to be associated with poor communities as opposed to affluent communities, that a facility developer might say, oh, well, the cumulative impacts of all these other polluting businesses is not nearly as important a stressor on the overburdened community as the fact that they're all poor. Well, he won't say they're all poor. It just so happens that there aren't any stores that sell fresh fruit, and there aren't any, not everybody can afford a car, et cetera, et cetera. All those social stressors and, high unemployment, et cetera. And so that by introducing all those additional stressors, it has the effect of downplaying the significance of the environmental stressors, which are the ones that you have regulatory authority over. You don't have regulatory authority over the unemployment rate or the presence or absence of supermarkets in a particular community, or hospitals or medical care facilities. You have authority over polluters. And to me, stressors which are unrelated to sources of pollution should be of de minimis importance when it comes to the health of the residents of a community. If you find that applicants say, well, these are very real stressors, and I won't disagree with that. I say, well, let's look at their rate in communities that don't have any environmental stressors, that don't have any polluting facilities in their area, and compare the health outcomes using your traditional health measures of those communities. Take a poor community in the middle of Pine Barrens and compare it with Ironbound. The health measures may be different, although the social stressors may still be present. That's my point.
Okay, thank you. So we'll certainly take all of what you said into account. I want to address the question of our authority. I think the bill does give us authority to consider these social determinants of health if we think it's appropriate. I think in order to make those determinations, we need to be able to connect those social determinants of health, those present kind of population conditions to health conditions. And I think that what the bill contemplates is that that these communities, for a multitude of reasons, are overburdened. And that includes those facilities, but it also includes other factors that might be causing health impacts. And I think if the department determines it's appropriate, and we have the scientific basis to make those connections, correlation or otherwise, I think we do have the regulatory authority to consider those things. I'm not suggesting what of those things we're specifically going to include, because I've made those decisions yet, but I do think that we do have flexibility to do so.
I'm concerned about justice for these people who live in overburdened communities. If I were a developer of a polluting facility, I would say, oh yes, introduce all these social stressors, because that discounts the pollution that I'm generating and that my fellow polluters are generating.
I understand what you're saying.
For DEP, it's the pollution that you're concerned about. It's not the presence or absence of medical facilities or the unemployment rate. And so if you're going to insist that those be considered in a community, well, then compare the health impacts, things like asthma rates between Ironbound and a small community in the middle of Pine Barrens. I think you would quickly see that you could that the asthma rate in the Pine Barrens is going to be much lower than the asthma rate in the Ironbound, and consequently, there is a health impact due to the presence of the polluters surrounding the Ironbound.
I get you. I get you, Rick. Thank you. No, that's a fair point. I think it's a question of relativity. It's a question of how we use.
And you have to build relativity into your decision-making process. It's just like you have to look at the cumulative impacts of all the highways that crisscross one another within a short distance of the iron bounds, and the fact that and I'm picking on the iron bound, but it could be someplace in Camden and lots of other places throughout New Jersey. But you have iron rail lines surrounding that community. You have ports in that community. You have air pollution generated by Newark Airport. You have to look at all those cumulative impacts and the fact that it's a poor community and the housing is old. Those are historical impacts rather than present day impacts caused by the polluters that are at work today, the regulated facilities, if you prefer.
That's fair. Thank you. I think that goes a lot to the kind of the opening stuff we talked about, which was making sure that we're pointing to the right ones,
well,
emphasizing them correctly, and making sure that that we are. I mean, the goal is, as you stated, it is to protect overburdened communities. We need to find the right and appropriate kind of mixture of data to do so, and that's where kind of our analysis, sensitivity analysis, looking at individual stressors will, we hope, ultimately lead us. And we'll talk more. We'll talk more about.
I'm not denying the social
Thank you
stressors
so much.
exist, but you have to put them in the context of the environmental stressors.
Yep.
Which came
Thank you
first?
so
Loud
much.
and clear. I got you.
Yeah, thank you so much. We just also have a number of comments that came through the chat in writing, so we want to give some time for consideration of those as well.
Sure.
And so, Sean, it's quite a number. So I would say looking at guests at 707 is where we should probably start. And a few may have already been addressed, but that's really where the new comments begin.
Right. Okay. So I will we'll just make note that we will note and consider all comments, and I will try my best to answer the questions that that folks have presented. So Natalie Augusto-Fleon, would climate change exposure vulnerability risk analysis be only for present day or also looking out into projections for a period of time, for example, the lifespan of the facility? I think to the extent that we would include this, and certainly under consideration, it would be more forward-looking. That's certainly how we are presenting NJ PACT, and our sea level rise projections are all forward-looking. To be frank, sea level rise at this point only stands to get worse, and we will need to account for that worsening sea level rise and those worsening impacts as we move forward. So I think that would be more of a forward-looking process. Brian Ray has a very long comment that I don't want to shortchange. So let me just give me a second. I know how thrilling it is for people to watch me read a comment. Brian, if you wouldn't mind, I would ask you to either raise your hand so we can talk, or potentially we can respond to your comment offline. I'm not going to be able to adequately address the number of things you brought up on the fly here, but we can promise to get back to you if you prefer that, as opposed to kind of unmuting yourself.
Go ahead, Brian. You can unmute yourself.
There we go.
I was just throwing out a series of the projections, and
Sure.
I'd say the retroactivity that's at play here, because certainly we look at it in a vacuum as to what is now considered overburdened. But down the line, how does one proposed development lead into the outcome of other developments in the area in line with NJ PACT, for example? How does one project today that gets proposed create for an opportunity that does not allow other facilities to be created to offset some pollution in the future? So I was just throwing into there how one could affect the other, and we should really look at the long run, or at least the projected growth of certain areas that we're allowing development in for down the pipeline as they relate to NJ Pact, or creating for mixtures of pollutants that can overburden over time with other things to come and grow. But certainly I'm going to submit offline my comments to you all so you can chunk into them as you go.
Sure. Thank you. I mean, I think if I could, like, from a high level perspective, I mean, you know, the goals of PACT and the environmental justice regulations are similar, but, you know, obviously different focus. The overall focus is the protection of public health. You know, the environmental justice regulations focus specifically on overburdened communities and addressing the on the ground and real life consequences of multiple facilities. I think what you're going to see here, and just talking about kind of how these things evolve over time, I think the goal of the environmental justice regulations is to, and, you know, with additional regulation in other places like PACT, which is intended to bring emissions down over time, with the Energy Master Plan and the GWA report, which are intended to move us more towards electrification and an ultimate reduction of GHG emissions across the board, is, you know, if we are successful, is an ultimate reduction in the number of overburdened communities in the state. And that'd be a combination of both better, you know, better decision making by facilities, as well as better regulation to address these concerns. And the rules and the statistical information that we're using will allow for an evolution over time, as our sincere hope is that conditions in overburdened communities continue to improve to the point where they are no longer overburdened communities. And I think the combination of stronger regulations related to emissions with an environmental justice paradigm that forces facilities to operate better and forces them to address their emissions in a different way will ultimately lead to that happening. And let's look at some more.
Well, I will note to you, Sean, that a couple of them are more comments, like from Dr. Sheets. So we can certainly note his comment. Same for Amisha and Natalie. So the next question is really from Ann Bastian at 722.
Sure. How do we currently submit community input to the EJ division for pending applications? Well, we can put some information in the chat in terms of how to get in touch with us. Obviously, we have Deputy Commissioner Glenn here, who's the leader of that effort, and her staff. So we can certainly take input on that and have conversations about specific applications outside of this room, so that, you know, we can make sure that your concerns are being heard to the extent that we have an ability to address them. So we can certainly put some information about how to contact us, both at our email addresses and through our general inbox. So we can do that. Dave Pringle had a comment, not a question. So I think that if we can get that contact information to Ms. Bastian, so she knows where to get to us, I think we've reached kind of the end of our comments, unless folks have more they'd like to offer us.
Yeah, I would just certainly like to add to Ms. Bastian's question that certainly, you know, you can filter or funnel through a question to Sean or me. But if it's already a pending permit application that's before the department, we just really want to keep the line simple. And what we'll do is make sure that we send it to the appropriate program so we don't complicate the process any. But certainly we're here to be a first line and can get any inquiry to the right place.
Perfect. All right. As I like to say, Olivia, I think we've worn everybody down. But I will say my routine thank you to everyone for joining us tonight, for really valuable comments and engagement, for pointing out things that we need to continue to look closer at, and for helping us to you know, direct our efforts in the right place. I was remiss in our earlier session, but I want to publicly thank our team, Steve Anderson, Sherry Driver, our rule team, Ryan Knappich, Melissa Beta Marco, Julia Wong, Armando Alfonso, Mike Gordon, obviously Deputy Commissioner Glenn, Office of Environmental Justice, Rashay Outlaw, Nadia Akbar, Mandy Futney, and anyone else that I missed, unfortunately. I apologize, but the work that we do is a product of all of the work that those folks do. So I want to make sure that I thank them publicly at every opportunity. And with that, I want to wish everyone a good evening, and thank you again. Olivia, anything else you want to say?
I can't top that. And so I thank you, and I thank everyone who came on tonight. We truly appreciate your weighing in on this very important process.
We'll see you in a couple of weeks. Thank y'all.